Hey there, it's Dr. John DeGarmo, Director of the Foster Care Institute, with the Foster Care Institute Tip of the Week. Through the years, a lot of people have asked me, Dr. John, what's one of the greatest moments you've had as a foster parent? So many of them come to mind, but I think about one in particular right now, and that was watching a child learn how to laugh. A child who had suffered so much pain and anxiety. This child learned how to laugh after a while, and I knew when the child was laughing, there was some healing going on. Over the next couple weeks here at the Foster Care Institute Tips of the Week, we're going to talk a lot about different forms of therapy that you can do in your own home. And one of those is play therapy. Now, to be sure, there's been a lot of information written about play therapy, and we cover it in the book, The Foster Care Survival Guide. But play therapy is something that you could do in your own home. It allows a child to express themselves through the act of play, and healing takes place. Unfortunately, we all know that many children in foster care have never had the opportunity to play, or some might not even know how to play. That means this. That means you might have to get down on the ground with a baby or an infant and roll a ball back and forth or play some blocks. Maybe those children who are a little bit older, playing Legos or playing dolls with that child. For the older kids, it might look like you going outside and throwing a basketball or football around with them, or maybe a frisbee. These small, insignificant acts of play can be very healing for a child who's suffering from anxiety. And play therapy, again, is something that you can do right in your own home. Hey, if you like this week's Foster Care Institute tip, make sure you go to the Foster Care Institute, sign up for the special membership, and get access to over 50 hours of online training webinars where we talk a lot about different forms of therapy. Hey, for this week's Foster Care Institute tip, I'm Dr. John DeGarmo. Now, don't forget to play a little bit yourself now, okay? Have some fun. Cheers.